Hello students, my name is Mrs. James Obeli. I'm your clinical instructor. Today we are going to conduct a procedure called vital signs. Vital signs is consisting of 5 cardinal signs, which is your temperature pulse, your blood pressure, your respiration, and your weight. Here with me is student nurse Jessica. She will be helping us out today. Say hello to them.
Hello.
Okay. In the tray, in the tray, these are our equipment. We have our sphig, that we have our stethoscope, our sphygmomanometer. We have the 2 gallipods here, which is your swab, your spirited swab, and the dry swab. And over here, I have the thermometer. These are our thermometer for temperature. The sphygmomanometer is for your blood pressure. And checking pulse and respiration, we use our eyes and our finger. So we're going to start. The first thing you're going to do, make sure you clean the tips. That's the earpiece of your stethoscope. Make sure you clean it with spirited swab and you dry it up. Then you check if it's functional, if it's working. Yes, it's working. You put it around your neck. Then you check your sphygmomanometer if it's working. Inflate it so that you see if it's working. Yes, it is. Then you deflate it. Now, I have to talk to my patient. You have to reassure her because some people are always scared of this procedure, but you reassure her to be calm. Ma, please relax and cooperate. And when checking your vital signs, please make sure there is no noise around you and the patient is not operating her phone or trying to see what is happening. She should just relax. So the first thing you do is you take the patient's hand, you open the clothes so that you have easy access to check our blood pressure. While checking your pulse, you use these 3 fingers, your thumb and the 2 following your thumb. And this is how you check it. Make sure you always have your breast watch. Checking of your pulse is 1 minute. I can feel her pulse right now. And checking of your respiration is 1 minute too. So to make it easier for you to meet up time during your OSCE, the first thing you do is, after raising up her check, you check if your thermometer is on 35 degrees Celsius. It should be at the end. After checking that, you put it. You can loosen a button. Then please put the bulb directly under the armpit, that's the axilla. The bulb should be directly under. If it's not directly under, it's not going to read. Then what I will do next is to check my pulse, check for the pulse, because I can't check for the blood pressure now because the hand is what I used in checking. So I'm checking for my pulse. With your breast watch or your wristwatch, you can just check. When it's 1 minute, you check for your respiration. When checking for respiration, please do not let the patient know you are checking for respiration, because some patients can be mischievous. While checking, they want to increase their breathing or reduce it. So just pretend like you are still checking the pulse and be looking at the patient. And while checking your respiration is back cycle. Inhale and exhale is 1 cycle. Inhale and exhale is 1 cycle. That's how you count it for 1 minute. While checking your pulse is 1 beat per second. So I'm checking for our respiration, but the patient doesn't know I'm checking for our respiration. After I'm done with 1 minute checking for the respiration and pulse, then you can now remove your thermometer from the armpit, then you check. After checking that, we are going to flip it back to 5 degrees Celsius, then please make sure you always clean it, because this thermometer can be used for another patient. So you clean it properly, you dry it up, then you put it back into the casing. And sorry, I didn't mention earlier, once you are checking your temperature, please make sure you always clean the armpit of the patient. If the patient has a towel of her own or his own, you use it. But if the patient doesn't have, please make sure you use your cotton bud to clean it, because some patients actually sweat a lot and it can alter the value of your temperature. Okay, right now we are going to check our blood pressure. Now please, can you relax? Don't worry, you'll be fine. Reassure the patient. Make sure you tie the cuff 2 centimeters above the brachial artery. And when checking for blood pressure, make sure you do it on a high platform or a high table, because when you want to check for blood pressure and the hand is below the heart, you get the wrong reading value. But when it's above the hand, you get the right reading value. And when you put it this way, you have to bend this way, eye level, so that you'll be able to read the value properly. So what I'm going to do is, like, as I checked earlier on, I've checked if this is working, and it's working already. I'm just going to put it on the brachial artery. I'm going to cuff my cuff. When doing this, please stop at 160 because she's still young. So the first sound I'm going to hear is the systolic, while the second sound, the second filling sound is the what? Is the diastolic. So as I check her blood pressure right now, it's 120/60, and that pulsation sound is called the Korsakoff sound. Thank you very much now for your cooperation, and I'm going to loosen my cuff after deflating it. So I'm using my cuff now. Now please, can you just relax? When putting your cuff into its casing, that's the sleeve, please don't just put it anyhow. Arrange it properly so that the next nurse will be able to use it. You can see the way I'm folding it. Folding it and putting it back into its casing. Then you close it. And after you're done, please make sure you still clean the earpiece for the usage of the next nurse. Dispose it. So I'm going to tidy up my environment by putting my equipment back into the tray. And the next thing you do after checking the patient's vital signs is to document. Make sure you write the patient's name, the age, and the time and the date which the patient is in the hospital. Then you write down your values in your chart, the patient's chart. Thank you so much.